I come to you today and to tell you that we're seeing how quickly COVID-19 can change a situation. This time last week, our numbers were still increasing, but they were steady. They were not spiking. They were not surging. They were at a measured pace. And our hospitals had patients with COVID, but they were not talking about capacity issues. Everyone felt very comfortable with the pace at which we were treating those patients. And we, as a city council, began the process of hosting recovery roundtables to consider how to reopen our city. And as always, we've said and tried to set the expectation that we would look at our numbers, hospital capacity, testing capacity, positive test cases, and based on the numbers and the data, we would make a reasonable common sense decision on when to reopen. In a matter of days, our situation has changed drastically. A local panhandle business as a hotspot has had a direct impact on our numbers in Potter County and the city of Amarillo. I want to share some updated data with you about our status. When you look at the state average of cases per capita, so cases per 100,000 citizens, the state averages at 81 cases per 100,000 citizens. In Potter County, our numbers have now jumped, and we average 188 cases per 100,000 citizens. So that's more than double the state average, and that change has come upon us quickly. Our mortality rate across the state is 2.08 deaths per 100,000 people. In Potter and Randall County, we're averaging 3.19. So again, we're above the state average in mortality rates as well. A little piece of good news is that we are testing above the state average also. Statewide, they are testing 833 people per 100,000. And in Potter and Randall County, we're testing 1,238 people per 100,000. So that is a good, strong percentage jump over the state average for the number of people that we're testing. Of course, that's tied to the fact that we have more people with symptoms because we do have the disease spreading through our community at a rapid pace now. So I wanted to provide that data to you because it's changing quickly, because we are going to make decisions based on data. And I want to say how much I appreciate our health department and the work they're doing to get us the data as it's coming in real time. It's a big workload, and I'm very grateful for the work that they're doing. I also appreciate very much Dr. Scott Milton, who has made himself available at all times to answer questions and to help us process the data as it's coming in. So we have good experts that are leading us in Casey Stoughton and in Dr. Scott Milton, and I'm thankful for that. I want to let the city know that I know many of us have doctors as friends. We have doctors that we rely on to take care of us or to take care of family members. I want the city to be able to hear from some of our community doctors and get their input as we listen to them as friends and we listen to them as trusted caregivers in our community. What is COVID doing to our community, and what are their opinions, ideas, thoughts, concerns about how we fight the outbreak in our city? So today at 5 o'clock, we have a panel of doctors who are going to join me to share their thoughts. And I would invite you to watch via Facebook, either off of the mayor's page or off of the city's page. But even if you don't catch it at 5 o'clock, of course, it'll stay up. You can watch it over the weekend. But I think that will be a good perspective of listening to those community leaders in the medical community share some of their thoughts in addition to what we've been sharing this week through press conferences. The recovery roundtables are still happening. A week ago, we set those up thinking that we were on pace to, with our data, start reopening the city. And I think for expectations, we're seeing that change. But those recovery roundtables have been very important. Many people, over 200 people have participated in them. And I'm so grateful for every citizen panhandle-wide, not just Amarillo citizens, that have given their time to give us their thoughts and their insight, to ask their tough questions. We're going to take that information and still start crafting it into a plan and some action steps. So when our numbers show us hospital capacity and positive testing results, when we're ready, we want to have that plan ready to go. And we're having a special meeting at the City Council today to talk about that and to get started on that plan. I also wanted to let you know that I signed a letter this week along with 6 other West Texas mayors to send to the governor to let him know that we feel like the state of Texas needs to be working where it can be working. Any business that can be open safely should be open, and we feel like that is best determined at, there's more agility to determine that at the city levels. And so the governor is doing a great job of leading our state. It is a big state, and it's a lot of geography to cover and try to make decisions for. So we wanted to give him that point of view that at the city level, we're watching our numbers. We feel like we have some agility to respond city by city in how we reopen. And for instance, Amarillo is 2 or 3 weeks behind on our curve compared to the rest of the state. We certainly wouldn't want the rest of the state to wait until Amarillo's numbers said it was okay for everyone to open. So we're going to be watching our numbers and making wise choices, common sense choices for Amarillo. But that letter went to the governor asking him to begin to open the state as each city's numbers reflected they were ready to safely do that. So stay tuned. Things are changing rapidly here in Amarillo. I'm asking you as citizens to stay engaged with us. I'm asking you to stay sheltered in place and to be all in with us, because now it's as important as ever that we be stopping the spread in our city. Thank you.
Thank you, Mayor. Now I want to go to Casey Stoughton, Public Health Director, City of Amarillo.
Thank you, Dave. Thank you, Mayor Nelson. As of this morning, there were a total of 422 cases of COVID-19 reported in Potter and Randall counties. We have 67 recoveries, and we're thrilled about those recoveries. We do have a total of 8 deaths in Potter and Randall counties. I wanted to speak for just a moment on masks. Your mask protects me, and my mask protects you. Right now, it's critical to protect one another. Wearing masks, hand washing, and staying home are the best ways to do that. If you're sick, please call your doctor. If you're experiencing symptoms of your chronic health conditions, please also reach out to your doctor. If you're well, please consider donating blood with Coffee Memorial Blood Center. If you're in need of COVID-19 testing, the drive-through testing center provided by Amarillo Public Health and Texas Tech Health Science Center continues today until 3 o'clock p.m. Please call 378-6300 and our call takers will screen and direct you to testing. And that's all I have today, Dave.
Thank you, Casey. Now I want to go to Dr. Scott Milton, Public Health Authority, Texas Tech University Health Sciences Center.
Yes, thank you. I think Casey said it best, but I just wanted to remind everyone to continue to practice social distancing. Wearing a mask is so important because it's being a good citizen, because you're protecting your neighbor. As of this morning, there have been 10 convalescent plasma infusions, and we've had 2 local donors. As Mayor Nelson alluded to, we're seeing still some increase in various hotspots into our hospitals from the area. I think it is safe to say, however, over the last 48 hours that our ventilator use seems to be about stable. So I'm glad to report that it doesn't seem like that's jumped as much as the numbers have. But that's all I have to say.
Thank you, Dr. Milton. Now I want to go to City of Amarillo City Manager, Jared Miller.
Thank you, Dave. From a public safety standpoint, our statistics are actually up over the last day versus this time last year. Amarillo Police Department was up 3% for calls for service. Amarillo Fire Department up 13%, AMR, or the ambulance service, up 2%. What that indicates is that we're moving around more than we were this time last year. So I would ask everyone to just be safe while they're out and about. Take extra care and precaution when you're driving. Also take extra care and precaution when you're visiting essential businesses or taking advantage of the retail to-go scenarios that the governor has allowed. With regard to the governor's orders, as a reminder, the governor's executive order GA-16 went into effect today. Under the governor's order GA-16, from today until April 30th, customers may not go into any non-essential retail business. per guidance issued from the Department of State Health Services, or DSHS. However, customers may continue to purchase items from non-essential retail businesses for pickup, delivery by mail, or delivery to the customer's doorstep. The DSHS guidelines also require all employees inside non-essential retail businesses to be wearing a mask. To see the governor's guidance, or to see the guidance and more information, please visit dshs.texas.gov/coronavirus. The governor's indicated that he doesn't expect GA-16 to be extended in its current form, and therefore it's very likely that it'll be modified between now and May 1st to take effect on May 1st. We'll provide updates as soon as we know more with regard to that, and we expect to know more today or Monday. AmarilloAlerts.com. As a reminder, the city recently announced a new emergency notification system to provide current and factual information on a variety of events, including COVID-19. We encourage citizens to sign up for the service at AmarilloAlerts.com so you can stay informed. As of this morning, we had over 4,700 people had signed up for these alerts. I want to also remind everyone that the drive-through testing center is still open. If you feel sick and have symptoms you feel may be COVID-19, call the public health hotline at 378-6300 to be screened for the drive-through testing center. Finally, our pet pantry. While the pet pantry continues to be successful in providing help, yesterday we had to close it early due to traffic concerns, safety concerns regarding traffic. What was happening is citizens were coming on 34th, turning south on Osage, driving past the queued line of cars, and then doing a U-turn on a 50-mile-an-hour road. Absent traffic, it's not that much of a safety concern. However, some of these were three-point turns and other things broadwise on a high-speed road. So we had concerns for the safety of the patron or the citizens that were coming to the pantry. We cleared the line and then closed a little early. We are going to, the pet pantry is going to be open again on Tuesday with some changes implemented in the traffic control plan to help ensure the safety of those participating in the pet pantry. This is likely going to include a change of location so that we can better manage the safety concerns. We'll notify everyone as soon as these plans are made and finalized so that you can all plan accordingly. We still have plenty of pet food to give our community, courtesy of Merrick Pet Care, who's graciously donated the food for this project. I want to take a little time there to just go into more detail about how much we appreciate Merrick Pet Care. Without their continued and incredibly generous support of this, we couldn't be doing it. It's all because of Merrick Pet Care that we're able to do this, and their quality products and commitment to the city of Amarillo and to our community and citizens is what makes this all possible. So thank you to Merrick Pet Care. That's all I have.
Thank you, Jared. At this time, we do have a couple of questions that have been submitted to us from KVII Channel 7. I think these two questions would primarily be directed at Mayor Nelson and Jared Miller. If anyone else wants to participate, feel free. The recent higher number of positive cases here in Amarillo could mean a larger number of people on track to become ill. If so, will reopening businesses come later here than other places in the state with reference to the governor's retail to go idea?
I think the response absolutely has to be dependent on our numbers in our community, how the disease is spreading, at what rate are our hospitals able to care for those people, our medical supplies, whether that's PPE, the different types of medicines that we need in order to treat these patients, ventilator capacity, continued testing capacity so that we can trace if we've got a surge going, do we have enough testing kits in order to manage that surge and properly quarantine people who are positive, even if they don't need hospitalization, and do the contact investigations. If we surge outside of our ability to do contact investigations, how can we safely notify people who've possibly been exposed and slow the spread that way? So those are all of the components that are going into whether or not we can begin to reopen our city. And right now, as the numbers indicate, we are surging. We do have at least one hotspot that we know of, and getting it under control and watching over the next 14 days for sure as those numbers climb out of that hotspot, the exposures out of that hotspot, our numbers are going to be affected by that. So absolutely yes. Whether or not we can reopen the city is tied to watching our numbers. And right now, our numbers are not indicating that our city is ready to open.
Mary, the only thing I would add to that is we're working actively with the governor and the governor's office to be able to articulate our challenges and our situation here. And I think the governor's done a great job of providing flexibility to local jurisdictions through the governor's orders. And that's one thing we're working with there too, because that could have an impact on how things go here as well.
Yeah, Jared and I had a call with the governor's office last night. So we're talking directly about the spike that's happening in Amarillo. We are talking directly to the governor's office about it and working that issue.
Thank you, Mayor. Thank you, Jared. Another question here from KVI Channel 7. The JBS plant in Cactus picks up workers at the Walmart on Georgia. And considering the recent state investigation or state help with the JBS plant, should the city consider addressing this kind of daily travel to a spot like the Swift plant?
Jared, you go first and then I'll fill in.
All right. The JBS is an essential business, so they are going to continue operating as long as they're open. DSHS, along with city personnel at the request of Moore County, did go out to provide some assistance and input. It is very apparent that they're doing a lot of work at the plant and working with local authorities to do what they can to address the situation. Our ability to impact that is somewhat limited in that they are in a different health district that is managed by DSHS, not by the Amarillo Area Public Health Authority. So we are coordinating and providing assistance where possible. And we are assured that the state is putting a lot of effort and calories towards addressing the situation as well.
I think it's important for us to look at this situation and to learn from it. People getting on buses together, being in an enclosed space of any kind, people working in a work situation that they can't be distanced and 6 feet apart from each other. This is what happens when you have those conditions. So as much as we would like to will it to not be the case is physical distancing is what will stop the spread of the disease. I want to emphasize how vital these meatpacking plants are to, of course, to our panhandle economy, and we're sensitive to that, but they are very vital to the nation's food supply. And so to say they're an essential business doesn't fully describe the category of just how essential they are. And they are having to change how they operate in order to stay open, in order to continue feeding people. So what we need to do is come alongside them, help them, provide as much expertise as we can in that process, and watch and learn what happens when a business has employees that work close together, when people are using vehicles to transport people without the distancing that they need to stop the spread. It can happen, it can explode quickly. And now we've seen that happen. And so I would appeal to every business owner in our panhandle area. Let's watch and learn from this situation. If you cannot configure your business so that people can work and interact at a distance, then it could happen this quickly in your business. And you could be the next headline, and we could be on a call with the governor's office trying to discuss how we react and maintain hospital capacity and medical care for the folks that are coming out of your situation as a hotspot. So, you know, we have tremendous compassion for the folks that are affected by this current hotspot, and we're going to pull together and work as an entire panhandle community on how to help those neighbors. And we're also going to learn, and we're going to watch as business owners, as community leaders, as pastors over churches, as school district leaders. We're going to watch and learn just how quickly this spread and the conditions that it spread through. And we're going to keep that in mind as we move forward in this situation.
Thank you, Mayor.
Can I add a little bit to that? I just wanted to say that it's clear, you know, the problems that we've had have to do with people that are confined, whether that be voluntarily or whether that's the way they work or whether that's just the way their life is. But another thing I think that's important is the people's behavior when they're For example, I'll give you two examples. Certainly, we had a problem almost 2 months ago with a basketball game and a basketball tournament. Well, what do people do when they go to a basketball game or a basketball tournament? They're excited, they're yelling, they're screaming, they're hugging each other. And so their behavior is conducive for transmission. Another example would be out of Washington State. There was an example of people who were going to church, and they were actually practicing good social distancing, but they were all in the choir. And so they got in a confined space where they were close together and were singing. And they had a marked increase in transmissions to many of those individuals. And so I think a lot of it has to do with our behavior when we get around each other. So once again, I think that's also important to realize how important masking is. And if you're going to do these kinds of things, you know, if you get out in the community, masking is just very important. So thanks. That's what I wanted to say.
Thank you, Dr. Milton. At this time, we want to go ahead and open it to direct questions from the media. If you just identify yourself, if you have a question for an individual panel member or the panel as a whole, that's perfectly fine.
And we'll continue with the coronavirus coverage on air and online. To keep up with the latest, you can head over to our website at myhighplains.com. For now, let's go ahead and send it back to programming.
They're a business, they're an essential business, and they're making every step they need to make in order to keep operating because we need their product, but do it in a way that they can safely control any outbreak in their facility.
Okay. Has every retail business opened up today under the governor's guidelines, or are some waiting?
Only essential businesses are allowed open under the governor's order. Non-essential businesses are open, but only offering curbside pickup service. So they're not allowed to have any customers inside their business. And our order is coming in line with that, absolutely coming in line with what the governor has ordered. So where in the past Amarillo has had a low risk operation category, if you could operate your business and everyone be 6 foot distanced, even if you were a non-essential business, you could still operate under that low risk category. That category has gone away under the governor's new order. So I expect that we will get more guidance from the governor at the first of next week. And I understand for business owners, this is challenging in many ways. And one of the challenges is keeping up with the most recent order. And it's coming from the federal level at CDC. It's coming from Austin through the governor's office. It's coming from City Hall in Amarillo. So you're having to juggle a lot of balls and try. So many people they want to do the right thing. They're just saying, what's the right thing to do? So as of today, if you are an essential business, you may be open and customers may come into your establishment and following the CDC guidelines for 6 foot distancing and extra sanitation and that kind of thing. If you are a non-essential business as defined by the governor's office, then you are closed to having customers inside your premises. You may offer curbside products or whatever it is you can sell if you can operate on a curbside takeout manner. But that, let me emphasize, that is fluid. That's going to change. It's going to change from the governor's office early next week, we believe, and how that will affect us in the city of Amarillo, we'll know at the time and we'll adjust at the time. The name of the game right now is adaptability and resiliency. And I like our chances on that. Texas Panhandle, we're really strong at that. That's the superpowers for us, resiliency and adaptability. So we can do this.
There, for Casey, what are the ages of the latest deaths?
They haven't changed from last week.
I believe there was 7 last time I talked with you. No, there's 8.
I'm sorry, I'll have to get that information for you.
Thank you.
Well, according to the report card, we've got 5 in Potter County and 3 in Randall County.
Right. Yeah. For Jared Miller, if emergency calls and our COVID numbers are all going up. Is there any talks of making COVID recommendations a requirement now?
No. All of the conversation is to stay compliant and consistent with the governor's orders.
Okay. And for
I will add, Ariana, I mean, there are some requirements in place. I think I've seen some conversation about, well, is this just a guideline or is this a requirement? Or, you know, the governor has made some clear statements about essential businesses being open, about non-essential businesses being open, being closed. And where he has really issued guidelines are on houses of worship. Those are not under his order or the city's order as open or closed. There are guidelines out there for the churches, but there are definitely some requirements from the governor's office that are made very clear, I feel like.
And I'd also add, our number one guide as far as our local practices here. Dr. Milton is a huge resource to us, our public health authority, our public health department, the Department of State Health Services, and also the governor's office. So our unique situation, and whatever is unique to any city across the state, those four entities are going to be working together to decide how to move forward. So we're going to be working very closely with our public health authority and with the state as we determine how to go forward.
Ariana, we have time for one more question, please.
Okay. Since the media now has a time limit during questioning, how can our citizens and our viewers get all of their questions answered?
I didn't understand you. I didn't hear you at first.
Since the media now has a time limit during questioning, how can our citizens and our viewers get all of their questions answered?
Your questions can be emailed to the Public Communications Department at any time. You can email, they can call. We'll be more than happy to provide you those answers as soon as we can and as soon as the information is available. We have other media members that we want to get in here to give them an opportunity to ask questions as well. And they're also more than happy, they're more than available to send us questions anytime they want. Thank you, Ariana. Let's move on. I think we have David Gay from the Amarillo Globe News. David, how are you?
Good. How are you?
Fine.
All right. Fantastic. So I guess my first question is for Dr. Milton. You talked about how, and please correct me if I'm wrong, 10 plasma infusions and then 2 local donors. How many of those infusions came from the 2 local donors, if you have that information?
I believe that the last, within the last 48 hours, that number had gone from 6 to 10. And I think it's fair to say that those last 4 were likely from the local donors. What has to happen is that we kind of have to build up our reservoir, so to speak. And so our first donor got sent to, that plasma got sent to Oklahoma, where it was screened one bit more than sent back to us. And so as time goes on, we'll be able to have more and more of our own kind of in the bank here.
I guess a follow-up question on that is all the donors' plasma going to have to go to Oklahoma to be screened like that?
No, I don't think so. I think initially that's what had happened. But as far as I know, that once we start building up a reservoir and kind of an inventory, that we're going to have more and more that's going to be available for local use.
Okay. And then you talked about how the ventilator use throughout the hospitals has been more stable over the last few days. Is there a specific reason you see to that, or is it just the way the virus has been going this week?
You know, last weekend we had a real jump in numbers, and it was alarming. And those numbers have continued to rise. I know at Northwest on Wednesday there were 41 ventilators, and we had 20 of them in use. And I was visiting with Dr. Weiss this morning. That number's 19. And so as some people get better as they get moved off, and then there's other individuals that get admitted and they need the ventilator. So over the last 48 hours, I think it's safe to say that it's fairly stable. It's still concerning.
Sure. And then I guess the last question I have is for Casey. Do we have any updated demographic information for the most recent cases or any of the information released in the report card?
Sure. So, you know, the numbers are very, very fluid, and we're getting numbers that come in even right before the press conference. And I want to be able to give you the most up-to-date information. So we have 422 cases that have been reported to us as of this morning. I did not have time to do all of the statistical work on those this morning, but as of the cases that were reported from yesterday, I can tell you that 9% of those cases who had tested positive, 9% were Asian, 10% were African American, 32% Caucasian, and 30% Hispanic. So again, this is a very fluid situation. Those percentages will change as I'm able to do that work with the cases that were reported today.
All right. Thank you so much. Thanks, Dave.
Thank you, David. Now I want to go to, if I'm right here, we have Jack Kessler of KMR Channel 4, if I'm correct.
Yes, sir. Yes, sir.
How are you, Jack?
Good. This first question is for Mayor Nelson. I know Tyson has closed a couple plants across the country. Have we heard anything about them closing the plant here?
I have not.
Okay. And Canyon has canceled their July 4th celebration. Are we doing the same, or is it too far out to know?
I believe the chamber's discussing it, but we don't have any guidance on it yet.
Okay. This next question is for Dr. Milton. How prepared are area hospitals for the expected surges in cases?
I think it's fair to say that they're prepared. And so everyone's, on heightened alert. And I think PPE use that's a precious commodity, but I think in the hospitals, it's adequate, and staffing seems to be adequate. So I think as of right now, we're in good shape.
And then another question for you, Dr. Milton. Despite all the precautions being implemented and observed, is there any concern that enough is not being done to curb the spread, or not enough people are following recommendations?
Well, I mean, compliance is an issue in lots of things that we do, especially in medicine. So that I could answer that in a lot of different ways. It's clear that the only remedy for this still is social distancing, and so I think it behooves all of us to try to practice that. And then I'll also say that the big problems that we've had in terms of having a large number of influx of admissions over a short period of time have been when people get into confined spaces. And so, as time goes on, I think that's going to be very important that if people start moving around more, that we're going to try to really work with everyone in the public and with the city in terms of trying to reduce these that type of risk where people are congregating in large numbers.
Is there any precautions that you would recommend at this point?
Well, yeah, of course, I've been recommending a lot. I mean, all along, I've been recommending people wear a mask and stay 6 feet away and to wash your hands. Is that what you mean?
With this expected surge, is there any other precautions that you would recommend that you haven't already?
No. I think those are the most important things are the practices of social distancing and being compliant with that.
Okay. I will add in that there are certain parts of our community that are better able to shelter in than others. People who work in essential businesses cannot shelter in. And so that puts their families at risk. As those essential workers come and go every day, then their families are at a higher risk. So just because they might want to shelter in, they might want to avoid it, their family is involved in essential workers, and we need them to continue to operate the city and put out food and the things that we need, even in a sheltered in state. So if that's not your family, it is your time to step up to the plate. We need you to shelter in. These other families are doing what our city needs them to do to keep us functioning. What we need you to do right now is to stay in, because you can stay in. They can't. And so if we're just choosing to go out because we can go out, that undermines the sacrifices and the efforts that those families are making who don't have that choice. They're essential, and their work product is essential. So I'm calling on, and those are strong words, and I know I'm delivering them with a strong tone, but I'm calling on families and community members who can. They do have the option of staying in. Their role is to stay in so that these other people can go
out. Thank you, Mayor Nelson. And the last question is for Casey Stoughton. How is JBS reporting numbers, and how close are they working with DSHS?
So I think, especially with regard to individual groups and individual agencies, and each of those, especially individual agencies outside of our jurisdiction, that would certainly be a question for them. With regard to individual agencies within our jurisdiction, we certainly work very closely with them, and we want to support them the very best that we can. It's important to know that those working conditions within a certain environment, that also translate to outside, just like Mayor Nelson was talking about when we're calling on folks who can do their part to stay in, to support those employees who have to go to work. That's so critical. It's also important, when you live and you work in an environment that is in a congregate setting, that's a risky situation that increases the risk for COVID-19. And so each time that we're involved in a situation, we work very closely with that organization. Your specific question about JBS and the Department of State Health Services, that would have to be directed to the Department of State Health Services.
Okay, thank you. I have no further questions.
Thank you, Jack. We do have one more representative here from Channel 7, Brandon Carpenter. I may be incorrect on that.
Yeah, you are. That's okay, David. It's Roger Gray. Directed at the mayor, just to follow up. Obviously, you're absolutely right. The packing plant falls under the essential business category. As of yesterday, they had 114 cases there. And we were the folks who videoed the workers being picked up here. Obviously, you have no control over the plant and its operations, but would it be advisable, or is there any thought to controlling the pickup procedures, the protocols followed? 6 buses showed up yesterday to pick up workers so that they could be spaced out in the buses. They all crowded into 2. 4 buses went back to JBS empty. Many of those workers had been inside the Walmart on Georgia before getting on the bus, and their cars were parked there all day.
Roger, you have highlighted the problem. And the problem is that once it begins to spread in our community, it is spreading. And because those people have family members, they come home at night, those family members are going to Walmart to get groceries. So the spread is real, and the spread is happening right before our very eyes. And what we need to do is learn from this situation. Yes, I think getting on the buses was part of creating the hotspot, and it brought it, I think, into our community. As business owners, we've got to analyze how our businesses operate, that we might be creating those confined spaces where people are breathing on each other and contributing to the spread. Specifically as to that situation and those buses, it's been discussed, it's been recommended, it's been advised, both by dishes, I think, and by, of course, it's outside of their business is outside of our jurisdiction, but they have asked for our recommendations, and those were given to them. So the fact that the buses are located inside our city, well, then that's covered under the essential work order, and they're going to work as an essential business. So what we really need are for people to make wise choices. We need business owners to analyze how they're operating their businesses and to make wise choices. We need employees to be vocal and disciplined about abiding by those and choosing to follow and to protect themselves and their families by addressing those concerns with their employers. So this has got to be a team effort. And every time we see a misstep, we're going to see it in our numbers, and then we need to learn from it. So just a direct answer to your question is we're learning. We're all in the fluid process together, and we're learning.
Just a quick follow-up, if I could. Is there any thought to, since it is occurring within our city limits, the actual pickup, and there was
they've been asked to spread those people out at 6 feet on the buses, and my understanding is that they have equipped themselves with extra buses in order to meet the spacing guidelines.
But there was an obvious language barrier there that was not communicated to the people. They crowded onto 2 buses. Is there any thought to perhaps assigning that the pickup and drop-off times, police officer or some public official to regulate the boarding of the buses, to make sure the protocols are followed because they are within the city?
I don't know that that's been discussed. So I guess we're, like I said, the situation is fluid. We're still looking at solutions, and we're working closely with that business owner, we're working closely with the governor's office, and we're working closely with DSHS to work those solutions. So I don't know specifically if having a police officer to seat people on the bus has been addressed or not, but every solution is on the table. And as this situation is one that we're learning from, we're certainly crafting those solutions right here as we go.
Yeah, and they're also installing partitions inside the buses to separate the passengers and reduce the capacity of the buses.
Well, that won't work if they don't get on the 6 buses, but okay. Thank you.
Thank you, Roger. That was all the media questions we had for today. Once again, we do these news conferences every Monday, Wednesday, and Friday at 11 a.m. I want to thank all of our panelists for joining us today, taking the time out to keep the community informed. Once again, this is David Henry. I'm the Communications Manager for the City of Amarillo. We will see everybody next Monday at 11 a.m. Thank you.